Bismillahirrahmanirrahim. It is a continuation of the previous two videos, and we are discussing the February 15, 2022 FCPS Part 1 Medicine and Allied attempt. The MCQ number 80 would be: the mean is the sum of all observation divided by total number of observation. Drug used in the acute attack of migraine after paracetamol is sumatriptans. The woman needed a renal transplantation. Best match for organ transplantation is her identical twin. Mallory bodies are found in alcoholic hepatitis. ESR decreases with increased albumin. Diabetic patients with gastroparesis, we give metoclopramide. Female on steroids for past 7 years. First to treat is hyperglycemia. Temperature regulation occur in anterior hypothalamus. Blood supply of taste area is middle cerebral artery. Structure anatomically related to aorta and ligamentum atriosum is left recurrent laryngeal nerve. Muscle flex knee and extend the hip joint is semitendinosus. Pulselessness, CPR done, ETT passed, IV not established. Drug that has no benefit when given via the endotracheal tube is norepinephrine. Difficulty in swallowing, white growth inside the esophagus with pseudohyphae is candidiasis. Histoplasmosis most commonly involve organ system is reticuloendothelial system. Associated with the cigarette smoking is thromboangiitis obliterans, which is Buerger's disease. Patient undergoing TB treatment, inability to differentiate between the red and green color. The side effect of ethambutol, cystic sarcosis in human caused by ingestion of ova or egg of Taenia solium. Best test to monitor hepatitis B is SGPT. Structure loop around the arch of aorta is left recurrent laryngeal nerve. 5-year-old boy fevered for 2 weeks. Epistaxis, diffuse lymphadenopathy. HB is 5.6. TLC is 100 into 10 to raise per 9 per liter and platelets is 10 to raise per 9 per liter. Diagnosis is acute lymphoblastic leukemia. Factors 7, 9, 10 dependent on vitamin K. Rethke's pouch derived from the stomodium of the foregut. Patient is in emergency with hypoglycemic coma. Finding will be sweating. Daughter is typhoid positive. What prophylaxis to the father? Ciprofloxacin 500 mg once daily for 2 weeks. Leg injury. Dorsiflexion lost due to damage to the common peroneal nerve at fibular neck. Total bilirubin is 10, direct is 9, and patient has jaundice. Choledocholithesis. Derived from third pharyngeal arch is stylopharyngeus, which pleural layer is completely innervated by phrenic nerve is mediastinal pleura. 65-year-old, jaundice. HB is 4.5, bilirubin is increased, reti count is increased to 9%, smear show polychromasia and clumps. Test to confirm diagnosis is Combs test. Generalized skin nodules, scratches on the face, loss of hair and eyebrows, nasal bridge shortening, give history of contact, acid-fast bacillus positive. Biopsy of the skin nodule shows Mycobacterium leprae. Sorry, I forgot to change the page. So there is generalized skin nodules, scratches on the face, loss of hair and eyebrows, nasal bridge shortening, give the history of contact, acid-fast bacillus positive. Biopsy of the skin nodules shows M. leprae. Newborn baby with erythroblastosis fetalis, A positive. For exchange transfusion, receive A negative. 35-year-old female, anterior mediastinal mass, bilateral ptosis during evening from last few weeks. Antibodies against acetylcholine receptors are positive. Drug that is hypoglycemic cause metallic taste in mouth and diarrhea is metformin. Autoregulation of kidney is done by myogenic and tuberoglomerular feedback system. 4-year-old girl, no congenital anomaly, edematous abdomen, distended abdomen, edematous body, distended abdomen, hepatosplenomegaly, brittle, shiny, weak hair, hyperpigmentation. The patient has kwashiorkor. Patient has end-stage fatal disease. Physician should give clear and crisp evidence knowledge diagnostic based for his benefit. Pia matter extend into the sulci and gyri of the brain tissue. Osmotic diuretics act on proximal convoluted tubules. Lymphatic drainage of external nose and anterior part of the nasal cavity to submandibular lymph nodes. Potent anabolic hormone is testosterone. Patient has potassium 3, sodium 150, pH is 7.45, excess of which hormone? It's the aldosterone. During thyroidectomy, what is at risk while ligating the inferior thyroid artery? It's the recurrent laryngeal nerve. Most of the maternal inheritance of diseases in newborn is due to the transfer of the mitochondrial DNA. History of the RTA, fibula neck fracture, foot drop, loss of dorsiflexion, loss of sensation over the dorsum of the foot, damage to the common peroneal nerve. Parts of conduction system is the terminal bronchiole. Friends went to restaurant, eat chicken and fried rice, develop food poisoning. Causative agent is Bacillus cereus. What food is responsible? Fried rice. Patient has generalized edema, proteinuria, causes hypoalbuminemia. Change in size and shape and polarity of the cell is dysplasia. 62-year-old congestive heart failure, dyspnea, orthopnea. Mechanism of pulmonary edema and congestive heart failure is increased hydrostatic pressure. Final common motor pathway is alpha motor neurons.